Tonight, advocates are calling on the government not to ban Australians with disabilities from hiring sex workers using NDIS cash. But in the face of spiralling costs, can the NDIS afford to fund sex?
Taxpayer-funded sex workers.
Yeah, we'll rule it out. It's just not a sustainable proposition. It doesn't pass the test, does it?
Set to be banned under new reforms in an attempt to rein in the National Disability Insurance Scheme's exploding costs. Specialised sex workers have been allowed under the NDIS since 2020, after the federal court ruled the services should be approved where reasonable and necessary. Advocates today pleading with the government to keep it that way.
We're working with people with psychosocial disabilities, people who are learning about safe relationships, people with physical disabilities. It's a very important part of life.
They point out there are other more effective cost-saving measures the government is yet to act on.
We see automatic rolling over of funds up to $400,000 or $500,000 a year without any face-to-face contact whatsoever. We need to bring the human back to NDIS, and that's how we get our budget back on track.
The number of NDIS participants who reportedly use the service is tiny, around 130 people out of more than 646,000. That's 0.02%.
I'm aware of one sex worker being paid for about 3 years ago.
But critics say any amount is too much.
I do not want to pay, or you don't want to pay, for someone to have a wild old night between the sheets on the taxpayer's ticket.
The Coalition for years now campaigning against the practice.
If you wish to use services such as that, Australians are free to do that, but to use their own money. Money under the NDIS should not be being spent on prostitution and brothels, full stop.
The cost of the NDIS this year alone is $42 billion. The scheme projected to overtake the age pension as the most expensive area of government spending within a decade.
When we talk about such a small number of people and then we talk about the sustainability of a $40 billion a year agency, it really stretches belief.
So, with warnings the scheme is set to become too expensive to sustain, is banning sex workers the answer?
Well, disability rights advocate Ellie Di Marcellia is one of those calling on the government not to ban sex workers from the NDIS. Ellie, many people at home may struggle to understand why sex therapy is considered reasonable under the NDIS. What would you say to them?
Well, firstly, what I would say to them is we are roughly talking about 130 people on a scheme of 650,000. That's 0.02%. So firstly, this is distraction. We are not talking about money that is going to save the NDIS. But what we are talking about is teaching people healthy sexual interaction. Women with disabilities are twice as likely as women without disabilities to be sexually assaulted. We are talking about incredibly vulnerable people, people who can't move their arms, who can't get out of bed, who are, vulnerable to exploitation, to abuse, what we've heard in the Disability Royal Commission. If these things can keep them safer, I'm all for it.
That's all well and good, Ellie, but if people want to have that from the NDIS, what's wrong with the public, the taxpayer, saying, well, why shouldn't they pay for it themselves?
Well, if you can't move your arm and legs and can't leave the bed, I don't know how you expect them to pay for it. But the government decides what to pay for all the time in terms of helping people's health. We subsidise Viagra through the PBS all the time to help men have better sex. So I don't know why we can't help people with disabilities have sex as part of a life of their own choosing. That's what the NDIS is all about, giving people with disability a life of their own choosing. And I don't know any viewer out there that had to decide about a life of their own choosing who would decide to have a life without any kind of sexual intimacy. So I think we're all being a little hypocritical there. But I'm going to take it back to the fact that we're talking about 0.02% of people on this scheme. I want to get back to talking about things that are going to help 98.8% of people on the NDIS.
Ellie, we know that the NDIS is life-changing for so many people, but it's at risk of absolutely blowing out when it comes to costs. What can we cut then to make sure that this is a sustainable program for lots of Australians?
Absolutely. And the government initiated an NDIS review that spoke to thousands of people with disability and came up with some incredible recommendations. And the government needs to get on with implementing those recommendations, making support coordinators, the people that find supports for people with disability, independent, so they can't work for service providers and recommend the same service providers they work for. That's dodgy. We need better planning for people with disability. So people with disability aren't going around and getting 8 different reports from their doctors and specialists and allied health professionals, and then NDIA planners aren't even reading those reports. That's wasting NDIS money. We need the government and the Senate to get on with passing the NDIS bill with the amendments that are on the table. Every single day that bill is stalled, money is being wasted. Stop with the distractions. Stop with the scandalous headlines. Stop with this kind of demonisation of people with disability and get on with the real work.
Ellie, I wanted to touch on that because how have you felt over the last week with the sex lives of people in your community becoming a national discussion?
It's just demeaning. It's just, people with disability in this country face real barriers. We face real barriers to getting out into the community. We face real discrimination every day. And what are headlines today? What are we choosing to focus on? 130 people getting some sex therapy. Why are we so obsessed with the sex lives of disabled people when we should be obsessed with making our communities inclusive and bringing people with disability along with us? Do you want us part of your communities? It doesn't feel like it.
Ellie, we really appreciate your time tonight. Thank you.
Thank you.